Hi, everybody. I'm here today with Dr. Jon Bafford, who's a good friend of mine and also my chiropractor. And I've asked him to share with you the reasons why, especially when you're exercising, that you might want to consider the care of a chiropractor, because oftentimes we have no idea what's lurking inside our bodies that might cause us injury or pain. So take it away, Dr. Bafford.
Thank you, Carmen. Again, my name is Jon Bafford. I'm a certified sports chiropractic physician in the middle of my sports diplomate. I'm also active release technique certified. So one of the things I think Carmen wanted to introduce myself is some of the misconceptions of chiropractors. Unfortunately, there are some different chiropractors. I'm in practice for 13 years, and I have to say the first 7 to 8 years I was strictly just the spine. You know, the market dictated the headaches, neck pain, back pain, carpal tunnel symptoms, sciatica, symptoms that related to the spine. But since then, we've engaged a lot of certifications, such as active release technique. This is a wonderful technique. It's not a massage. It's created by Dr. Leahy out of Colorado Springs, who works with most of the professional athletes in hockey, the Olympic athletes at the training center, and he's a team doctor for the Denver Broncos. So he created this technique, and what's really nice about the active release technique is when I go to these seminars, there's a mixture of doctor, physical therapists, chiropractors, sometimes MDs, and we also see licensed massage therapists here. So this is one of the major soft tissue techniques out there for the shoulders, the hands, the feet, the knees, the extremities, basically. So these are one of the techniques that we're bringing to Newark, Licking County region. I'm the only one certified in the active release technique. So what this helps me is expand my practice for people that get these cumulative injuries through training. You know, we see, and a lot of people talk about some of the strains that people get through the boot camps, P90Xs, CrossFit centers. So we kind of help start to get specialized in those type of injuries instead of just going to get a shot or a brace, which basically can sometimes immobilize the injury. Also, a functional movement screen expert, trained in the selection of functional movement assessment, a corrective exercise specialist from NASMA. Again, for people that have improper movements, they're forcing their bodies to increase mobility and stability they may not have. Those are also areas of concern that could put them into a higher rate of injury or chance of injury. So those are some things we can help screen an individual and show them where some of these stability, mobility issues lie, so they can be aware of them when they're actually training with their instructors.
So Dr. Bafford, what would you say to some of my clients who've never been to a chiropractor because they're afraid?
Yeah, we hear that a lot, and for the most part, chiropractic is considered a conservative care. It's one of the most conservative cares out there. My malpractice insurance is very cheap, and compared to what medical doctors and surgeons been practiced for 13 years. So again, there's a high statistic of a lot of the athletes, functional high performance athletes, using chiropractors. So if chiropractors were out there hurting people, most of these athletes would not be going to them, because athletes are going to chiropractors to increase function and performance.
That's a great point. Can you tell my clients where you're located, because you are convenient for them?
Well, I'm located at North 21st Street, 843 North 21st Street, on the corner of Mao. And like I said, I've been a chiropractor for 13 years, and our number is 740-366-5599. And you're welcome to call us and just mention this video, and we can possibly offer you a new patient special.
That would be great. And what are your hours? They're changing April 1st. Would you share those with my clients?
Yes, my hours are going to be from Monday through Thursday, from 9 to 12 and 2 to 6. And of course, Fridays could be appointment only in case we need to get a hold of someone in the mornings.
Okay.
Or someone needs to get a hold of us.
Okay. And one last question, Dr. Bafford, and that is, if I have a client who's watching this video right now that says, oh, I've got some problems with my knees, or I've got some lower back pain, or my shoulder's really aggravating me, especially when I'm in my workouts or my personal training, is it just a good idea to just give a call and get in here and see what's going on?
Yes, if I feel like we need to get another second evaluation, we'll make sure we can do that. That's why becoming a sports chiropractor exposes me to sports injuries other than the spine, the shoulders, the elbows, the hips, the knees.
Okay.
Of course, I believe in working as a team with other physicians and other doctors, so if we need to incorporate someone or need to get a second opinion, I can order MRIs, CTs. So anything, to help that patient get better quicker or to gather more information about the injury, we can do that.
Okay.
But this is a good place to start because a lot of times we send people, they just get a shot or an anti-inflammatory painkiller, and then they're given a brace and just told to rest. Well, that may be good in the beginning stages, but it's not when you start trying to rehab and trying to get back to normal function.
And you do accept insurance, yes?
We do accept almost all insurance. If you come to our office, we do a complimentary benefit check to find out what's covered, what's not covered for you, and we can sit down and talk about that before anything's really done with your treatment, if necessary.
Okay, well, great. Thank you for your time. And again, I want to encourage all my boot campers and personal training clients. If you do not have a chiropractor, it's just like getting a hairdresser or somebody to do your nails. When you're taking care of your body, your body, you only get one, right, Jon? And so we got to take care of that and treat it well. So I encourage you to stop in and see him and his team of professionals. Have a great day, everyone.
Thank you.